Hi, I'm Dr. Hurme from Amityville Wellness Integrated Health Center, and I'm here to tell you a little bit about cupping. There's a lot of news going on recently since the Olympics have been on, and everyone has these cupping marks on their back. There's actually a lot of different techniques that we could use when we do cupping. There are 3 techniques. The first style of cupping is called flash cupping. This is where we put the cup on and take the cup off the body immediately. So this is what it looks like. You put the cup on, take it off, put it on, take it off, on and off. This technique is used for disorders of the lung. This helps to loosen up phlegm in the lung and help increase the function of the lungs. This can be done on the front of the body, on the back of the body, anywhere on the rib cage to improve lung function. So again, this is flash cupping. The cup that I'm using right here, this is a cup that we actually use for children. Typically, if you're an adult and you come in for flash cupping, we use fire cups, which I'm going to show you in a second. So the second technique that you would use for pain, or a technique that I should say that you would use for pain, is called static cupping. And this is where you take a cup and you put it on the body and you leave it there. This technique tends to leave those big marks on your body. Now, the interesting thing about those cupping marks is that the color that comes up is actually used as a diagnostic tool in Chinese medicine. If the mark that is left on the body when the cup goes away is, say, a dark purple or black, that means that the circulation in that area is not functioning as well as it could be, and could be a cause of the pain, which is why a lot of times you see those dark cupping marks on the swimmers recently in the Olympics. Sometimes you take the cup off and there might be no mark, and that means that the blood is circulating and there's no issues in that area regarding stagnant blood, which we call it in Chinese medicine. Another interesting thing about cupping is that it is multicultural. We practice Chinese medicine here at Amityville Wellness, but cupping is thousands of years old and it goes through many cultures. A lot of our patients that are internationals come in and they might be Italian and they saw their grandmothers get cupping, or Russian or Polish. All those people, they come in and they've actually seen their grandparents get cupping done at home in their hometown country, which is pretty cool to have people familiar with it. The next type of cupping is called sliding cupping, or sometimes people call it walking cupping. This is when you put lotion on the body and then you're going to actually slide the cups around. Now, this technique feels really good depending on what you're actually doing it for and who's doing it to you. So, like I said, in other countries, the cupping technique is passed down from generation to generation and taught by their elders. In the United States, cupping is taught in acupuncture colleges, and it's also a continuing education course for massage therapists. So you might get cupping from your massage therapist, you might get cupping from your acupuncturist. Whoever you get it from, you want to make sure that they were trained properly and that they do know what they're doing. So again, like I said, the type of cupping we do here is fire cupping. I think in the Olympics, typically they're using, it looks like suction cupping. We find that the fire cupping is more effective, and that's why we use it here at our office. So now I'm going to show you the sliding cupping. And so sliding cupping is really good to help de-stress, and it's also good to help detox the body and the muscles. Whoops. So this is where you're really just sliding the cups around. And you're moving them to different parts of the body. So here I'm working her erectors, which are muscles that run up and down the spine. If she was having shoulder pain, I might leave the cups right here. Try and make her look like Michael Phelps. But like I said, a lot of patients come in to get cupped just to de-stress because it feels amazing. Dakota, how are you doing?
It feels great. I want to go to sleep.
Yeah, it's very, very relaxing. You can see, so now remember I told you that we use the cupping marks as a diagnostic tool. So you can see when I slide the cups up and down her back, a redness comes up. So that redness is a sign that she has a little bit of inflammation going on in those muscles. And actually before we started taping, I was asking her, you know, is she having any pain anywhere? How's she feeling? And she did mention some upper back tension and low back tension. So if she was coming in for an actual cupping treatment, I would probably do static cupping on her low back and leave those there while I put the needles in. And I might do a little bit of sliding cupping on her upper back. And the way we determine that is just by doing it for so long, since it is part of our scope of practice and something that we're taught in school. So like I mentioned really quickly, we do cupping with children and babies. We do a lot of time for allergies to boost the immune system. That flash cupping that I used over here, that will help to boost the immune system. For babies, a lot of times we also use it on the belly, going around the large intestine, and that helps the flow of the large intestine and peristalsis, and helps if babies are constipated and things like that. So the children love cupping because it's kind of a fun thing. It feels good, and again, it's painless. And when people say it is painful, it's because their provider isn't communicating correctly with them and checking in on the patient and seeing how does it feel. If the cupping is painful, then it's being done incorrectly. So just be aware of that if you ever do go and get cupped. But so let's just see if Dakota has any marks. Typically you would leave the cups on someone's back. If we were to do static cupping, you could leave the cups on their back for maybe 20 minutes, 25 minutes. And if you were going to do the sliding cupping, you might do that for 15 minutes. Or if you're going to do the flash cupping for something like emphysema or asthma, you might do that for, say, 15 minutes. So let's see, it's only been a few minutes. Let's see if Dakota has any marks on her back. Doesn't look like she's got too many. Let's get a little one there. And one other thing, the length of time that the marks are left on the back vary with everyone. Depending on how good your circulation is, your cupping marks can go away immediately after the treatment, or they can last for up to a month, depending on how good your circulation is. So that's something to keep in mind. If you're going to the beach, you always want to make sure, you know, you may or may not want the cups, or if you have a wedding or something to attend. But I hope that answers all your questions with cupping, and be well.